Hello, I'm Dr. Ki-up Kim, Korean facelift surgeon, extended deep plane at Lift Plastic Surgery in Seoul.
How does this difference affect the surgical approach in a deep plane facelift?
It fundamentally changed the objective of the surgery. In Caucasian patients, the goal is often to lift and restore lost volume, so repositioning is frequently combined with fat grafting. In East Asian patients, the goal is more about repositioning existing volume rather than adding more. Overcorrection with volume can easily lead to an unnatural, heavy appearance. So, even though the same deep plane technique is used, the surgical intent is different.
Does this also influence the directions or vectors of the lift?
Yes, and this is one of the most critical differences. In Caucasian patients, the lift is typically directed vertical vector, upward direction, because that matches their pattern of tissue descent. In East Asian patients, the lift is slightly directed spirolaterally, upward and slightly backward. Their aging pattern is more about downward displacement of heavier tissue, so this type of lifting vector corrects the problem more accurately. If you apply a purely lateral pull to an East Asian patient, it can look unnatural without truly fixing the descent.
What roles do ligaments play in these differences?
In Caucasian patients, ligament laxity tends to occur earlier, making it relatively straightforward to release and reposition tissue. In East Asian patients, the ligament can be stronger while the overlying tissue is heavier. This means that a more complete and precise ligament release is necessary. Otherwise, the lift may not be effective.
With all these differences, how do you ensure the result still looks natural?
The guiding principle is to restore, not change, the patient identity. A well-executed deep plane facelift should make the patient look like a younger version of themselves. That means respecting ethnic anatomy, not imposing on universal aesthetic standard. Ignoring these differences can lead to results that feel unnatural or culturally discordant.
So ultimately, what defines a successful deep plane facelift across different ethnicities?
Success comes down to customization. The surgeon must understand how anatomy, aging patterns, and tissue behavior differ between patients and adapt their aspect of the technique accordingly. When that's done correctly, the result is natural, long-lasting, and fully aligned with the patient's own facial identity.